I'm Alexandra. I'm a producer with Milwaukee PBS, specifically Black Nouveau. And so I'm hoping to talk to you a little bit today about what we know so far about COVID-19 and the communities it's impacting specifically. So to start off, I know yesterday a lot of reports came out saying that a lot of cases have been coming out of the Sherman Park and St. Joseph neighborhood. Could you elaborate a little bit about that?
Learning that there's more cases in that area. Just to be clear, that is my neighborhood where I grew up, the Sherman Park area. So it is very painful to see this, that COVID-19 is impacting my home community, my home neighborhood in this manner. Now, since the health department is working on this like 24/7, because this just started 2 weeks ago, that we're trying to have a better understanding of the data and what does this mean? Is it, one person, how they like infected a number of people? Was there an event or gathering that occurred where people were exposed? Did people attend the same facility and get exposed there? So those are the types of epidemiology investigations that we will continue to conduct. Since it's still fresh, we're still in the process of learning a little bit more about it, because yeah, it is alarming. And this is a science of public health, is like trying to get to the bottom of disease and disrupt it or interrupt it from causing more damage to the community.
And you all mentioned that there were some PSAs that were underway. I'm curious, in these preliminary stages, what types of reaching out or community engagement you all are looking towards to spread the message about the COVID-19 in these areas?
Yes, so outreach is super important, but definitely we need credible messengers. Like the health department is government, and I know some people, they're like, is government, they're a little sketchy, that are like, what are they saying? Of course, concerns about our healthcare system and some of the injustices that have happened as a result of the healthcare system over the years to the African American community. So, it's important for us as a public health entity to acknowledge that and look at, okay, what are some ways that we can help the community, our community, understand that we are here to help. When we started seeing African American cases, and we're like, okay, earlier on, we're seeing the majority of the cases in the city of Milwaukee were African American. And this again was like less than 2 weeks ago, where we're starting to spread the information about it. But now, as of yesterday, now that rate of infection is about half. So 52% of all of the cases are African American, which is a similar distribution to the city of Milwaukee, right? Like Milwaukee is a majority minority city. So we are about half of the population right now. So that's about on par as far as the infectious rate to our distribution in general. So we're seeing this kind of flatten out a little bit as more and more people were getting exposed and infected. So talking about outreach, what that looks like, since we can't do our traditional outreach of going and having events and doing like door-to-door canvassing because of the safer at home or stay at home order, we have to be savvy. We have to use leaders in the community, such as our faith-based organizations. And we are actually scheduled to meet at 2 today to talk about how congregations can help spread the word, as well as making sure people have basic human needs like food, medicine, money, whatever they need to kind of get through this tough time. And then also using social media to help increase awareness. So the messaging that we're putting out is lay low Milwaukee. So there's like stay at home, safer at home. There's all of these different tags that you're seeing, but lay low Milwaukee is definitely the direction we need to go in. So it's like not everybody has the ability to be safe at home. Some people's home situations are not, they don't support that. Their safety is in jeopardy at home because they might be in an abusive situation, or there might be multiple people and families living in one house, and there's not really an opportunity to have your like own space. So we do recognize that. And we also have created a variety of videos, and we'll be using different social media platforms. So the videos are like just general information, symptoms, hand washing, just reinforcing social isolation, social distancing to really help suppress COVID-19. And there's like two things that continue to block our ability to really like expand testing and access to care. And these things are coming from the national level. One, access to personal protective equipment. So having the right masks or respirators, goggles, head coverings, gloves, gowns, booties, anything that's going to protect you from contracting this virus because it's spread through droplet. The other thing is the shortage of testing supply. So it's not just the testing kits, meaning like the actual thing that's used to test for COVID-19. In the lab, there's a variety of other supplies that go into that. And some of those supplies are on back order right now through the national supplier who was identified by the federal government for public health labs in particular, which is super problematic because if we were able to ramp up testing and have a better sense of how many cases we really have, that will help us be more precise in our outreach and our prevention strategies. So until those two things come, we have to prioritize and kind of triage who gets tested and who doesn't. So the state released updated testing guidelines, I believe last week, and they have these 4 tiers. So the tiers are basically if you are in a hospital, and that's going to impact how they provide care to you and make sure that hospital workers aren't being exposed to COVID-19, then you're most likely going to get a test. And then if you're a healthcare worker, you're most likely going to get a test because we need them to be healthy to be able to serve the population. The testing guidelines are getting ready to be updated actually to add first responders, so fire, like EMS or emergency medical services, and police officers, because they are also providing support and interacting with the community. And we want to make sure that they're not picking up or being exposed to COVID-19 by doing their jobs. So that's in addition, and then there'll also be an addition for incarcerated people. So as you can imagine, if one person that's incarcerated is infected, they can infect the whole facility quickly because this is contagious, this virus is. So we want to make sure people are safe. So that's also being added to the testing criteria. So until we have more access to testing supplies, then we can have more widespread testing. So Ascension St. Joe's has been in the works of setting up offsite or drive-through testing. But the difference there is it's not like just drive up in like a drive-through restaurant or anything like that. You actually have to get screened first to see if you're eligible to get tested. So they want to make sure people are calling and getting the information and getting clear from a physician first, and then they're allowed to drive up and get tested in their car. So they don't have to step out or anything. The tests for COVID-19 are pretty basic. They're swabs. It's not like a blood test or a urine test. They use like a cotton swab, and it is in your nose and in your throat. And that's all they need. They package it up and then they send it to the lab.
For a normal person, say I'm just a community resident, what exactly is the process if they think that they may have COVID-19? Now, is there a specific priority on who gets tested immediately versus people that have to kind of wait it out?
Yeah, it depends on your level of risk and symptoms. So again, people that are over the age of 60 tend to have more complications. People with underlying health conditions tend to have more complications. And I mentioned this in an interview a while back, like, okay, if you're looking at who has the greatest prevalence of heart disease, diabetes, various neurological conditions, cancer, who's going through chemotherapy or radiation, who's pregnant, who just had a baby. Like you're looking at different populations, and that is increased risk factor as well.
Were there any last comments you wanted to share, Commissioner?
Well, so now that we are operating in this new reality, again, just promoting Lay Low Milwaukee, staying at home if you can. If home is not safe for you, There are access to resources. We are funneling everybody to 211. There's a number of hotel rooms and other resources, whether it's food, money, things like that, that people need to be able to get through this tough time. So we're trying to promote that so people have access to it, because a lot of people don't know where to turn.
Thank you so much for taking the time to talk to me today about this, Commissioner. I really appreciate it.